Assalamu alaikum dear students, it's Dr. Masuma Mehtab and today I will be giving basic concepts of celiac disease. So kindly be with me. So the disease is an immune mediated condition that can occur at any age. Such condition can occur whenever you are exposed to the gluten. Now you might be thinking that what this gluten is. This gluten is basically a protein that is mainly found in wheat and grains. This gluten is actually little harder to digest, so it sometimes can lead to the complications. The pathology of this disease starts when the gluten you take in your diet is digested within the stomach and is converted into gliadin. Now this gliadin is a pathognomic component of this disease. Gliadin normally picked up by IgA antibody and is destroyed, and it never allows to enter into the enterocyte. The problem occurs in the celiac disease that the IgA helps the gliadin to bind to the transferrin receptors. Now these transferrin receptors are iron binding receptors. This gliadin after entrance to the enterocyte is deaminated by enzyme TTG. Now this enzyme modifies the proteins post-transitionally. After it's deaminated, the macrophages sense up and eat up this structure and present it to the helper T cells by means of MHC2 molecules. Now these T helper cells release inflammatory cytokines that destroy and damages the villous surface of the enterocytes. Now you can see here that when a person takes up the gluten, it is converted into within the stomach, it is converted into gliadin and is picked up by the transferrin receptor, and within the enterocytes they cause the problem. So these cytokines which are produced by T helper cells destroys these enterocytes, and the villous structure of the enterocytes has been removed, or we can say these villi actually undergoes atrophy, and that is the major and the main problem of this disease. The patient will experience malabsorption and nutrients, he will be unable to absorb the nutrients, and the patient will have some complications we will be discussing in the next slide. So the symptoms, the patient will present to you with weight loss, fatigue, abdominal pain, bloating, loose stool, steatorrhea, that is the presence of fades in the stool, and the signs will be the mouth ulcers and angular stomatitis, abdominal distensions and muscle wastings and neuropathies. These are the clinical presentations of this disease. Another complication that a patient may develop is these herpes like vesicles, which we call as dermatitis herpetiformis. These are the skin lesions which actually occur in this disease. This disease, this clinical presentation was all about the adult form, but if we are talking about the child will have the abdominal distension, the muscle wasting, clubbing of the nails and failure to thrive. Now after the clinical examination, when you done the clinical examination, you have to confirm the test. You have to confirm the condition by means of tests. So you have to go for the lab testing. So prescribe the patient IgA antibodies against TTG and the gliadin and endomysium. After that, you have to suggest the duodenal biopsy. You have to suggest for the duodenal biopsy, and this biopsy will reveal that the patient will have atrophied or flattened villous structure of the enterocytes, and then you will confirm this disease. Do you know this disease doesn't have any proper treatment? However, as being a good physician, you just have to prescribe the patient a gluten-free diet. That means you have to treat the patient symptomatically by saying no to the gluten. that was all about the celiac disease. If you like my video, please comment, subscribe and click the bell icon. Thank you so much. Allah Hafiz.